Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah. Welcome everyone to ISD COVID-19 vaccination awareness webinar. We hope inshallah today that everyone could benefit. We have two great speakers with us, Dr. Shahnawaz Khan, Dr. Saleem Khan. And inshallah, just like, they will be look in a few seconds. Wanted to mention, if you have any questions, we do have the Facebook Live. You can post your questions there, and we'll be taking them and sharing them with the two guests. Also, you can call ISD at 302-733-0373. 302-733-0373. You can just click extension 0, and we'll basically take questions from there. And at the end, also, we will be sharing the presentation with whomever wants it. So please, if you have any questions, feel free really to call or put it on the Facebook. And if you prefer a phone number, this is my cell, 908-392-3694. 908-392-3694. You can text me, and I'll be sharing this with the two guests. Now I'll leave you with our two guests, and inshallah, hope everyone benefits from this. Jazakumullah khair. Dr. Saleem, you can take over.
A'udhu billahi shaitanir rajim. Bismillahir rahmanir rahim. I'm very pleased to be here today with everyone and ability to share some thoughts and experiences in a very, very important and very timely subject that we are going to discuss today in a short period of time. Just to put it in a historical perspective, there have been other pandemics and epidemics as far back as in the history we can recall. Before I get into that, I want to thank ISD administration, everyone, executive committee, people directly, indirectly who were involved in this effort. It is certainly very well needed. So going back, there was a bubonic plague. To the best of my recollection, it was end of the 14th century and beginning of 15. And then the one that more so we have heard on the news is the Spanish flu, which was about 100 years back. And again, there are so different estimates, but according to one source, almost half of the population of the world at that time just disappeared because of that. Basically from Europe, when the soldiers traveled to Russia, they took it with them. Then, as you may have heard many times, that Prophet ﷺ said that if there is something like a serious disease, for lack of any other expression for that, not knowing if it was a pandemic or epidemic, he instructed that people who are there, who in that community, should not move out, and vice versa, other people from outside should not come in. A lot of wisdom in what was said. So moving along, there is no question that America has been behind. We all know that. We are trying to catch up. And as you have heard in the news, President Biden has already said first 1 million doses per day. Now he went up to 1.5 million. I was reading about this Nobel laureate, Paul Romer, who said he developed a model according to which if we really, really want to tackle it properly, then we should be at 3 million doses a day. It's a very big challenge, but the president has the authority of War Act. So hopefully things will keep moving along nicely. When I reviewed other states, our state is definitely ahead of many other states. We have other challenges like the new variants from England, from South Africa, and also from Brazil. I'm just touching base on these things, setting up stage. Brother Shahnawaz will go into details of all those things. As we know that this vaccine was developed very quickly. The reason was we already had some experience with SARS and then the Middle East acute respiratory syndrome. And with that knowledge, our scientists were able to develop what is called mRNA. Again, Shahnawaz will explain all that. So right now, we have these two main vaccines, which is approved for emergency purposes, which is Pfizer and Moderna. And different states are getting different number of those. So I will leave it at that. Maybe just one last comment, because I talked to some people in Pakistan today. As we speak, Pakistan just started giving the China vaccine, which is called CoronaVac, developed by Sinovac company. And the India has developed its own, and even Russia has one called Sputnik. And I'm sure you have heard that in European countries, they have the AstraZeneca in collaboration with Oxford University, and then we are all waiting for Johnson & Johnson, because some of those later ones have different kinds of advantages. So far that I know, there is only one, which is Johnson & Johnson, which will be one shot only. So I will stop here and ask Dr. Shahnawaz to pick up from there. Dr. Shahnawaz?
Okay. Assalamu alaikum, everybody. It's been a blessing that we are all safe and healthy at this moment. I have to thank, first of all, ISD for creating this community event for everybody to benefit from. And also, I'd like to thank Dr. Saleem Khan for being collaborated with me in this presentation, which I hope that all of you guys would find it very informative. And after listening and hearing from us today, you can go home with some sort of better understanding of what Corona brought us from last year till now. Corona has been pretty rampant over the last year, and we've been trying to get some sort of grasp on this infection, which seems to be one step ahead of everybody. And because of that, we're still in the situation where we haven't fully grasped the whole infection control. I had my first talk back in March for ISD, in which we were trying to figure out what Corona exactly was. Today's presentation is an update on that presentation. So I will be giving you guys out a lot more information regarding what we've learned so far about Corona and how about we going out and tackling this problem as a community, as a nation, as a person, as a woman, children, how does it affect us? So with further ado, I'm going to start this presentation, and hopefully if you are joining in, you guys are most welcome to ask questions at the end. Would be taking, and Dr. Saleem Khan also be with me taking questions in order to alleviate any kind of questions and concerns that people have about the virus or vaccination events that are going on, so that everybody at the end of this meeting should feel a lot more comfortable with the vaccination and a lot more knowledgeable about how they want to handle Corona. All right, so Corona is been around for a while. But first of all, we need to ask us questions like, what is this virus, and why we should even worry about it? How has it impacted us so far, and how should we protect ourselves and our loved ones from this virus and this deadly pandemic? What tests are available to detect this virus, and how we able to today combat this virus with what kind of resources and how we can go around finding these resources to get immunized and protect ourselves and our loved ones so that we can all live a healthy and happy life. So a little background on the virus, which I'm pretty sure you all know because it's been out for a year, and media has been pretty on top of these things. So it's again, but for recap, I just wanted to say, go over a little bit. It's not a flu virus, so it's different than flu virus. So getting your flu vaccine, a lot of people think that it also protects against the coronavirus, which is not true. So that's why coronavirus vaccine has been created. Otherwise, we'll still be giving flu shots to correct both of these problems. So that's why it's important to get your corona vaccine separately and then the flu virus. It was discovered in Wuhan in China in about December 2019. That's why hence the name COVID-19 from the year name. And the first case in the US we found out in January 2020. So this is almost February 2021. So it's been almost a year past since we first diagnosed it, and we have a lot of deaths and a lot of morbidity because of this highly contagious RNA virus. It spreads through respiratory droplets, and on some surfaces, it can stay up to 72 hours. So that is equivalent to 3 days. So on surfaces like glass and stuff, it can survive up to 72 hours. So be careful. That's why we say sanitize. It has been showing a mutation over recently, like Dr. Saleem said, UK variant, South African variant, and also some Brazilian variants too. We're currently experiencing the second wave of this infection, which we knew that in the winter it's going to resurge again, and we're trying to get a grasp on how we're going to control this second surge. That's why vaccination is at utmost importance at this moment. So as I talked earlier about that, we had a couple of viruses that are floating around in the community, in the country, which includes the original novel coronavirus, which is COVID-19, which it has evolved into UK variants and South African variants and Brazilian variants. And you can see these variants, UK variants are up to 471. They do not increase the mortality. However, they do have a higher infectivity rate than the novel coronavirus. South African coronavirus variant, there are 3 of them right now. So there are 3 types of mutations that are found that came from South Africa. And these are more dangerous than the other variants because it has a resistance to a lot of these vaccinations. So if we don't immunize at this moment, we might lose this precious time to create a herd immunity and protect everybody. And we may need to work on finding a new vaccination protocol or vaccines, in a matter of fact, so that we can combat this disease. Then there's also a Brazilian variant too, which is kind of like in between South African and UK variant. Why should we worry about this virus? Because you can see how many cases and how many deaths have happened in world, in United States and in Delaware. These data is from the direct CDC source. So they've been monitoring this, and every day as we pass, we're seeing more and more numbers comes through, with the cases, and you hear more and more people passing away, good loved ones. But it's a shame that in this 20th century that we're still dealing with such a disease on an epic scale. So far this virus has came and impacted us, and we'd ask like how it has impacted us. It's impacted us on multiple levels, and I just wanted to go through it real quickly. Psychologically, physically, emotionally, financially, and socially. You can't go to parks and stuff without having to worry about catching corona. You can't go to masjid or schools or churches because they've been also being affected by the virus, and you always worry about catching a virus, and if you do catch it, what would be the result. And it has affected financially. A lot of restaurants, a lot of places that we used to take it for granted now are not in service or filed a bankruptcy. A lot of jobs and job losses has happened, and that has impacted mostly. So not only dealing with the physical and emotional and psychological stress, but also financially, it has pretty much crippled quite a bit of country so far, and everybody's trying to find a way to get out of this problem. It also affects lungs and stuff. So a lot of people who do get infected, they also have ongoing lung problems. So that is also one thing that a lot of people do not realize, that it also does that too. And then not to mention the stress and fear and isolation, all these kind of going. And one thing that it always started the trend of wearing a mask and hand sanitization. So all these things were kind of brought up and within the last year. So this is a new trend now. We used to think that whoever wearing that must be sick, but now I feel like everybody is sick. And this is kind of a very emotional, challenge that we have to be worried and vigilant about this. So how we protect ourselves, you probably hear it 1,000 times over the media, what we can do. Sanitize all the surfaces. Hand washing is very important, because that's the most common theme among people catching corona, is by touching surface or something that may have been infected with virus and then transferring it to themselves or their loved ones. CDC says wear a mask all the time. As a matter of fact, President Joe Biden has mandated that all federal and non-federal facilities to have mask wearing as a mandated, and also 6 feet apart. This social distancing has been recommended. People also are told to avoid large crowds so that they can avoid the transmission and propagation of this disease process. So what if you think you may have it or you have symptoms? What do we do? How are we able to find ourselves, that how we find out that if we're infected or not, so that we won't be worried about our own health, but also the health of our loved ones that are dependent on us or being around us, that they won't get sick. There are a couple of tests that have been going on. The best one is right now is RT-PCR, which is a nucleic acid amplification. What it does is just amplifies the nucleic acid through a PCR, which it takes a little longer to process, but it is by far the most accurate. So if you're thinking that you will have symptoms or you want to be tested for sure, I would recommend getting a RT-PCR test. There is also a rapid antigen test that give you results in within 15 to 20 minutes. It is very quick. However, it's not as sensitive, so it may misdiagnose or miss out on an infected person. So even if it comes back positive, right now the recommendation is to get it confirmed test with RT-PCR. So if you're planning to go get one, if you can get an RT-PCR and you can wait, I think that would be the good thing. However, if you're in a pinch and you want to find out if you're infected or not, you can do a rapid antigen test, which will tell you about the result too, at least, but it may have accuracy issues. Then there's also an antibody test. A lot of people have been asking, what is the antibody test? So it is the antibodies that are made after you've been exposed to a virus. So your body's response to that virus, to overcome it, it produces antibodies. So it should not be used for diagnosis of a current or active infection. It is used to diagnose if you've been in the past, been infected or been affected by the virus. So that is very most important. So when you go to want to get a testing done, that I would recommend that if you want to see if you were in the past or have been exposed to this virus and you have any antibodies, I would recommend then getting this test done. However, it does not diagnose current infection. Sometimes the antibodies after antibodies developed after 1 to 3 weeks of infection. So if you're trying to get to see if you were exposed and you within that 1 to 3 week interval time, it may not be positive, and you may give you a false sense of security that whether you have the infection or not. So be careful about that. Antibodies develop in response to infection, and it develops later on. So better thing is that if you want to get it done, if you have symptoms, wait until 3 weeks to get this test done so that you have a more accurate testing. At this moment, according to CDC, we don't know how long the protection from antibodies may be provided, and if you can get reinfection in the meantime, even if you do have it, because you do have variants of these strains going around, so you still can get infected. So my thing would be to still wear a mask, still do the social distancing, and still do the hand washing, which is utmost important. So all the science leads back to that thing. So we can't be not vigilant and say that, well, I've been infected and now it's not going to affect me. Chances are you can get infection. Chances of reinfections are rare, but it still can happen. So the question comes in now, if we have corona and these tests come back positive, what do we do about it? There are a couple of things that we do currently have in our arsenal to combat this virus. First of all, if you're having an active disease, you have medications like remdesivir, which has shown a lot of promise over the last year till now, that it lessens the intensity of the infection. And a lot of hospitals, if you're infected and you have severe symptoms, you get started on remdesivir. Most symptoms can be also dealt with because of it's like a common flu type. You can do with Tylenol and hydration. But if you are severely sick, I think in the hospital you will be put on remdesivir. So this is to fight active infection. Now, there are 2 vaccines that have been approved in America for its use to combat the COVID-19 virus, and there are BioNTech, that's made by Pfizer, and Moderna. They both have pros and cons. The pros is that these are very effective. One is 95%, the Moderna is 94% effective against the virus. However, they are also haven't had a chance to work on the variants. They believe that they also work for variants, but up to what level they're effective, it's still being debatable. They also create long-term immunity, so that is good. However, and they're cheap right now, so government, whatever they're providing is free. So make sure that you avail the first chance to get this vaccine. On the other hand, the vaccine has also cons too, like it is a shot. So like with any shot, it also subjected to a lot of problems with short site infections and other things. I've seen in my clinic a couple of people who got shot has a local reaction to like a reaction to the injection site, and also systemic reactions too. Also, the other thing is that it's a 2-shot series, so people have to wait until the second shot, and believe in the media and in the literature, the second shot gives you the more side effects of the vaccine related fever and other things. So that's, plus the thing is that with somebody's timeline, having to wait 2 shots is also a long time. Other thing is that, which we are all dealing with right now, is subject to availability and, like I mentioned, side effects. There is antibodies too that I'm going to talk about it a little later. Both vaccines are not, like I'm going to say again, they're not for the treatment of active coronavirus infection. They are given so that you can prevent future coronavirus vaccine. If you do have an active infection, you might want to go talk to your healthcare provider for further information about how to deal with that. So these vaccines are preventative, so they're not for active infections. So I have to in this slide that discuss about what is an active infection and what is immunity, and in immunity, what is active immunity and what is passive immunity. So active immunity is when you directly give a vaccine to somebody and their body makes the antibodies against that virus. And usually that is the best way to gain long-term immunity. However, there's also a passive immunity, which is works in a pinch if you're waiting for active immunity to kick in, or if you think you may have infection, you can use that. So it is the immunity that is generated after somebody else made the antibodies, and you take that antibody and inject it into yourself, which is not as good of a treatment as an active immunity, because once those antibodies dies, like any blood cell, those immunity also leaves with the antibodies, and then you be more subjected to open infection. So, and it's usually short term until the cell life. So again, the vaccine that are approved in the US, one is Pfizer BioNTech, which is 95% effective. There's recommended for ages about 16 years and older, and Moderna, which is 94% effective against the coronavirus, is recommended for 18 years and older. So children and adolescents, people are not recommended to get this vaccine because usually their disease process is not as severe as it creates in the adults. Both formulations are lipid nanoparticle formulated, so this is some scientific stuff. If somebody wants to read it, I have this in the slide too, but they basically affect the outside layer or covering or sheath of the virus, and they take a piece of that sheath and makes the vaccine out of it. So when body gets that piece of material from the virus, it learns how to combat that virus by making antibodies against that piece. So every time the virus shows up with that piece of enveloped protein, they kind of knows what to do with it. However, with the variation, that protein may be changed, and that's why there is a problem with the variant-based resistance from this vaccine. So schedule these vaccines. The Pfizer's BioNTech vaccine is given, and Moderna given in 2 doses intramuscularly. And the Pfizer's one is given 3 weeks or 21 days apart. Moderna one is usually 28 days apart, or roughly 1 month. So a couple of points I want to mention with these vaccines: that you should not receive a second dose earlier than recommended, because the thing is that, first of all, it is a limited supply. Second thing is that it won't help you gain more immunity. So you need to give the first shot a chance to create some immunity, and then second shot to boost that immunity further. So you can, some recommendations that you can get this vaccine 4 days earlier than recommended, and that's about it. Other than that, you should wait. Technically, you should wait until your time is up. The other thing is that you can delay a vaccine. Let's say the place you're going to get a vaccine has been out of vaccine, so you can delay the second shot up to 6 weeks or 42 days after the first shot. If you pass that window, then you may have to get both shots again to create a best immunity for yourself. So there's a window period. If you fall in that window period and you get it within that 42-day period, you still be good for a second shot to create immunity. However, if you fall outside that, then you may have to redo that. And there's still a limited data because these vaccines been out for a very short time. So we're still learning as we going along how these vaccines immunity creates. When you do get your first shot, they usually give you vaccine cards. Those are very important piece of information that you need to keep, because your second shot depends on it. And I'll tell you in my next slides that why it is important to keep those record cards that after first vaccination you get. So if you need to make backup copies, take pictures on a phone, keep it on a phone, so that when you come for a next shot, you'll know exactly what to do, what a person giving you the shot will have to do. So interchangeability. So they say, well, I got the Pfizer one, now can I get a Moderna? And absolutely, it's not recommended. So if you started out with Pfizer, BioNTech, or we started out with Moderna, my recommendation is to get the one at the correct interval, the second shot of the same vaccine rather than mix and match. It's not recommended at this time to mix and match these vaccines. So you guys really need to make sure that this happens. And that's why those cards that I was talking to you earlier about comes in handy, because God forbid if you forget, or you don't know what they gave you or when they gave you, the card will tell you the date so that you'll keep the correct time interval. And second, it also tells you what vaccine did you get. So bringing that card for the second shot is utmost important. Plus, some people would not give you a second shot if you don't have a card. So make copies, make backups of that card, and bring that to your next second vaccination. So what happens about the other vaccines? So you say we're still in flu season and I need to get a flu vaccine too. What do you do? So the data says, and everybody's suggesting at CDC that you need to have at least 2 weeks gap between before and after getting the vaccine. So if you've gotten a flu shot, you may need to wait 2 weeks to get your corona vaccine. If you already gotten your first shot or second shot of corona vaccine, I would say wait until 2 weeks for flu shot or any other shot, that vaccine that you need, like tetanus or any other boosters. So the thing is that this is very important. A lot of people may say, well, it's just a shot. I can get all the shots at one time, so I don't have to come back and get that. And that's absolutely not true. So I think everybody need to follow this so that you can get the best immunity possible for corona. People say, well, if my immune system is not good, do I need to get a booster of this vaccine? And the answer is that it hasn't been established, and usually it's not recommended. First of all, because of the reason that it is in a limited supply of the vaccine. And second thing is that we don't know if you're needing a third shot, because the chances are if you got the vaccine at the right time and the right interval and the right dosage and the right type of vaccine, you probably will develop immunity. Going further, vaccination of a person with a COVID infection or exposure. So usually the coronavirus vaccine is recommended for everybody who wants to get it, as long as they don't have any contraindications, meaning there's no reason why they should not. So the doctors and healthcare workers will kind of ask you about any kind of previous infections to the vaccine and stuff before they administer the shot, because that is important. Vaccines, as good as they still are medicine. And like any medicine, they also have their side effects. Now, if you have reactions to the prior vaccine, that is very important piece of information that a healthcare worker should know. So make sure you're forthcoming in telling all that information before you getting a vaccine, rather than finding out later on that you weren't supposed to have it, or you needed to be more vigilant about getting this vaccine. So be prepared and give all the accurate information to healthcare workers who are trying to provide you with the best possible situation. So vaccine of the person with the current COVID infection is not recommended. I would say wait until your illness and symptoms are over before you either get a first shot or second shot. So if you are sick or having symptoms, I would wait until you get the vaccine. Also, people who already had the infection, usually because of the limited supply, we also recommend that if they had the infection, they might have developed an antibodies that can protect them at least for 90 days. And the reinfection of this virus within that 90 days is very rare, but it can happen. But the main thing is that you would defer it for 90 days so that other people can benefit from the vaccine and protect themselves. So what do we do if a person got passive antibody therapy for corona? So if somebody has had infection and they received a corona antibody therapy, or they had the infection, what do we do? So there's no data of safety of vaccine who received the monoclonal antibodies for the infection in the past. Basically, again, it's recommended that you wait 90 days at least from the initial infection or antibody therapy to get the vaccine. Now, this does not affect the antibodies for other things. It's only mentioned for the corona antibodies. So other vaccines like ROGAM, other antibodies like ROGAM and other therapies of antibodies for different other medical problems are, there's no reason why you should not have the vaccine. So I would encourage, if you had it, don't hesitate and get your vaccine today, as a matter of fact. So special circumstances for people with that have a compromised immunity, what do we do? So my first thing is that everybody should get COVID-19 vaccine regardless, because it will create a herd immunity, which help protect everybody in the community. And the thing that if we don't protect everybody in the community, we'll have this virus running around rampant. So people with HIV, cancer, current immunosuppressive therapy, recent surgeries, doesn't matter how bad their health was, are still recommended to get corona vaccine if it's unless they're contraindicated. So antibody testing is not recommended to assess the immunity of a COVID-19, following the vaccination at this time, because it's drain on time and resources at this moment. And plus, you believe if you get the vaccine done at the right time, at right interval, and right type, you will develop a good immunity, even though you're immunocompromised. And for the same reason, revaccination is not recommended for immunocompromised patients once they regain their immunity, like cancer patients whose immune systems are down. Persons with a history of Guillain-Barré syndrome, which is shortened for GBS, which usually you see after a flu vaccine. There's no cases have been reported after the use of corona vaccine. So people who had in the past from flu vaccine Guillain-Barré syndrome are still supposed to get this vaccine, because there's no link between Guillain-Barré syndrome and COVID vaccine. So that is a myth. Some cases of Bell's palsy, which is a drooping of the face, happen after these vaccines. Those cases are very few. So people, CDC still recommends that people with Bell's palsy still should receive this vaccine unless they have contraindications that they shouldn't have vaccine. So those are usually determined by your healthcare workers before they give you the vaccine, whether you should have it or should not have. So special people like pregnant people and mothers who are breastfeeding, what do we say about that? There is a limited data about these vaccines since they haven't been out in the public in very long time. So we need to say, okay, these are special set of people, what do we do about it? There's the very limited data about the vaccine and pregnancy, and with the lactation, meaning breastfeeding mothers who wants to breastfeed their kids and think with the vaccine is going to affect their young ones. So the thing with the CDC, with the different animal control trials and the toxicity reporting, it showed that there's no added side effects than normal person for a pregnant person or a person who is breastfeeding the infants, so they can safely continue to do so. So if you do have like side effects from the vaccine and you're pregnant, Tylenol would be the most safest approach to reduce fever and muscle aches. So that is recommended. Ibuprofen and Advil are not recommended in pregnancy anyway. So please defer those medications and only use Tylenol. That would be more safer in pregnancy and will have a better outcome at the end. There was a recent article this morning I was reading. I wanted to share that coronavirus in pregnancy has increased mortality rate of 3.5% than a normal person. So mothers who are expecting, I would urge that they need to go and get vaccinated, because they catch corona during their pregnancy. There is a high risk of miscarriage and even death in those people. So it is very important that we need to protect ourselves so that you can enjoy your pregnancy with ease. Okay. So comes down to, once we get the vaccine, what do we expect? So the vaccination reactions are like any other medicine, happens to a person who do get vaccinated, and most of them are pretty mild to moderate, and usually starts in first 3 days and usually last up to a couple of days after the vaccination. It can range from anywhere from local reactions like pain, swelling, redness. At the injection site, some enlarged lymph nodes in that area where you got the vaccination, to more systemic effect like whole bodies affected with fever, fatigue, muscle aches, body pains and chills and headaches. So these are easily combated with Tylenol. So my thing would be, if you do get any of these, do take Tylenol. If you're not sure that what kind of reaction you're having and you're concerned about it, please do visit your local health provider, your doctor, to discuss these with him. There may be some other issues going on that you may not realize that it's happening, and the vaccination event was just a coincidence that happened with it. Everybody, that's why everybody should, with these even side effects, is encouraged to do get their vaccine, and regardless of these things happen. So the thing that, like I said in the beginning, also that vaccinated person should still wear a mask and still do the social distancing, avoiding crowds, and do the hand washing, do your deed, because it does take time for immunity to develop. It does take time for your body to make antibodies to combat this virus. So until that time happens, which is variable for everybody based on their age, sex, their medical condition, we can't say how long it was going to take. However, if you continue to follow the CDC guidelines for wearing masks, washing hands, and social distancing, we can safely get those get that immunity without having to worry about catching the disease while we're being after vaccination, which does happen too. So cautions and contraindications of this vaccine. So immediate allergic reactions are the ones that are the most believe are the worst that we can experience. Usually there's a past history of allergic reaction to other vaccines too. So if that happens, usually those people are monitored a little bit more longer after the vaccination event so that they won't develop anything. However, if you do develop, go to the nearest ER or call your provider to find out what needs to be done. However, there's at the sites of where at the immunization centers where you're being immunized, you also have ambulances and healthcare workers that are vigilant about these reactions. So they usually ask people to wait in the parking lot at least for 15 to 30 minutes before they can leave, just to avoid that kind of unnecessary problem for them. And if they do, usually the treatment is EpiPen and some steroids and stuff like that, which is for later. However, let's hope that nobody gets these things and they have an uneventful vaccination event. So, like I said, who should not have this vaccine? So usually the people who have immediate allergic reactions passed with the COVID-19 vaccine. So let's say if you had a first shot and you develop a severe allergic reaction, now the question comes in whether you should get the second shot or not, which is very tedious because after the first allergic reaction, you're probably going to have a more severe reaction on a second shot because body's already reacted badly on the first shot. So in those cases, if you think you still want to get the second shot, I would say to call or consult immunologist or allergist. They can look at your risk and then decide whether they need to get a second shot, or you can bypass the second shot just so that you can still have a avoid the allergic reaction. Some important facts about this vaccine. So we want to know what it does, and there's a lot of mistrust about the vaccine because it's been pushed out in such a short time, and there's lack of studies that have shown that what are the long-term effects. All those are valid questions and concerns, but the main thing is that at this moment, the disease is far more greater risk than these vaccines are. So I urge people to not to think about those and do get vaccinated. That not only protects themselves, but also protects the community around them, which can include from your loved ones to your neighbor. So do get vaccinated. It should be your duty as a model citizen and a person to not only protect yourself, but also protect the people immediately around you. So people ask, what happens if I get the vaccine and I do have the symptoms and I do get the testing done? Will it affect my testing to see if I'm corona positive, or is it always going to be corona positive? So that is a myth, and a lot of people ask me that, and I thought I'll put it in. It does not affect any kind of testing procedure, including TB and stuff. So if you do get the vaccine, it won't turn your corona test positive. Now, can be a coincidence that you can have a corona infected in the time you're developing immunity after the vaccination. That's why I said wear your mask, wash your hands, and avoid crowds and social distance so that you won't get caught in that time frame where you think you're protected while you weren't. So a lot of people for their jobs get TB tests. It does not affect any kind of TB testing. So a lot of things also floating around in the community that this vaccine was made from latex or material that came from pigs and eggs and stuff like that. All those are a myth, and this vaccine is not made from any of those substances. Actually, I was reading the literature on these vaccines. They're both made from polyethylene glycol, which is a common water-soluble product that is usually commonly used in before the colonoscopy to clear out your gut. So rest assured, there's no worries about that. You're gonna be injecting yourself with some product that came out of a pig or any other animal. So that is a myth. So I do want to stress that just because you think that it may have contained pig products or anything, it is not true. So do get your vaccines. Some other concerns, people say, well, if I already have COVID-19 and recovered, do I still need to get this vaccine because I already got the infection? The answer is yes, because there are a lot of variants going around. The vaccine will protect against most of them. So just because you got infected by one version of it, you create one version of antibodies. So having to get a vaccine would also help you protect against the other versions of that. And there's always a reinfection element that is also possible. So don't think if you got it, you're immune for life. You still can get reinfected too. All right. How long, we don't know how long someone is protected from these antibodies. That is also being currently being studied. However, we don't know, so still continue to do your part in social distancing, hand washing, and do get your vaccine to protect yourself from other corona variants too. So a lot of people ask, well, if I get a vaccine, how long will the antibodies or immunity would last? That's also too early to tell, but usually they said that if you are a healthy person and you got both shots at the correct timings and both the correct vaccines, first and second shot, you probably are good for 90 days. So if you want to see yourself that how it's going with the vaccine, I would urge that you can wait until 90 days. Hopefully we'll have more information that whether people need revaccinated after that time frame or not. But so far, it hasn't looked like that people needed a more revaccination because their immunity is pretty good after the first 2 shots. So there are a lot of other questions that comes in with the vaccine that would the vaccine alter my DNA? The answer is no, the vaccine does not change or interact with your DNA. It just goes into your system and helps your system figure out how to attack this virus by making antibodies against it. The other thing is that is it safe for me to get the vaccine if I'm gonna have a baby one day or if I'm currently pregnant? The answer is yes. Like I said, there is a high mortality rate in pregnant women if they catch the infection. So I'll urge you that to protect yourself and your fetus, get the vaccine at your earliest so that you be safe throughout the pregnancy. They also said, will the vaccination protect me from getting sick with COVID-19? The answer is yes. If you get the vaccine at the right time, it will protect you against infection. However, it does take time for body to develop immunity. So in the meantime, after the shots, do protect yourself with social distancing and wearing masks, hand washing, and sanitization efforts. So what is Dr. Saleem said that in future vaccines, Dr. Saleem initially touched on that. I'm going to reintegrate. There's some future vaccines that are in the pipeline, like Johnson & Johnson's vaccine. However, it's a single shot, so it does give some sort of immunity against the coronavirus. It's based off of a flu virus vaccine model. So a lot of times people try to mimic other viruses models to body to think that it is the coronavirus and then use it. It is still not approved by FDA, so don't go asking for your healthcare providers that you want this vaccine. One thing is that since it's a single shot, it is less effective compared to Moderna and Pfizer's BioNTech. It is 66% effective against the coronavirus. But the main thing is that at this time, CDC is looking at it that anything that's above 50% effective is doable for vaccination because they're trying to contain the infection spread. And by getting these vaccines, even though you may get an infection, but your severity of the infection is going to be a lot less. There's another vaccine called Novavax vaccine, which is 89% effective. It's not only effective against coronavirus, but also its UK and South African variants, and still in the pipeline. It's not approved by FDA. So you ask, well, all this is good. Where do I get my vaccines? So there's a couple of websites. Delaware.gov is the big source for Delawareans to go get this vaccination the right time and right way. You can also call your local health department to get the vaccination. They can also guide you. And then if all fails you, CDC has a very comprehensive website that you can go and get that. Currently, Delaware is being conducting phase 1A and phase 1B vaccination events. This is for people who are in frontline workers, like healthcare workers, first responders, and also people 65 and older. So register now if you're 65 and older through these websites to get your vaccination as early as possible and quickly as possible. This is just a slide to show that vaccination in phase 1B trial. As I mentioned before, this is the timeline for the vaccination, how Delaware is going through the phases. So usually phase 2 after phase 1 is going to start in mid-April, and phase 3 and 4 in May and June. On the website, if you go to delaware.gov, which I showed you up on top, that you have different places where you can get these vaccines, including pharmacies, vaccine events that the state kind of sponsors, and then also medical providers. Looking at that, some grocery stores also and some pharmacies have also contacts that are put in for these vaccines. That's for people 65 and older. So if you are that and you are registered, you can go to one of these pharmacies, given that you have registered earlier to get the vaccine on behalf of the government. These are the government or state-sponsored events. There's on the website, there's a page which can guide you step by step how you can go around registering for this vaccination event. These vaccines are free, and they are only given by appointment only time. So please don't call the offices or the website people, the numbers on the website, to say that or just simply show up at these places to demand vaccines. Make a registration, make an appointment, and then do go there and then get your vaccination today. So website also have a hotline number. If you don't have a computer, you can call this number to get your vaccine, and make sure that you fall into the category that is being given the vaccine. Some resources, some clinics that have put it up here for people's sake, for people's information, that these clinics are also performing vaccination for their community. Most of them are for their own patients, but also if you are registered, they might take you in. And so, but one piece of advice, most of these are listed on the Delaware.gov website, but they do mention on these things, as I'm showing on the slide, that do not call the offices directly and don't show up in person demanding a vaccination, because they're not taking any walk-ins. So if you register and you happen to be in that time phase, you might be able to get directed to get your vaccine through these other portals. Now, some pearls from Dr. Saleem Khan, who's going to tell you how you can go around getting your vaccines and stuff. So I'm going to leave the mic to Dr. Saleem Khan so that he can take it from this point on and tell us how we can use these resources. Dr. Saleem Khan, please unmute your mic.
How's that now?
Yep, pretty good. If you can focus your camera a little bit, I think we'll be all good. Okay.
So actually, I was supposed to introduce Dr. Shahnawaz Khan, but it occurred to me that he's so very well known in the community. He has made a presentation in March, and many of our community members, they are his patients. So he does not need any introduction. He also, towards the end, gave all those details that I had provided, because that is available on Delaware sites. So I spent a lot of time trying to call. So that's what I wanted to tell you, that even phone calls have not been easy, but don't give up. And the other thing is that, for example, CVS, which is about to start in our area, they have a telephone where they can actually schedule, even though it is for next few days to few weeks. Other than that, out of the 9 medical practices there are only 2 of them which are taking individuals who are not their patients. And in our area, immediate area, it is ENT and allergy. And they have a telephone number which is listed there, but they do require that you fill out a form so that they can contact you. So I was reading somewhere that if something comes to you from what is called VAMS, which is Vaccination Administration Management System, it is not a spam. It is to let you know that you have an appointment set up. I also wanted to say just one word about the people below 65 age. If you go to some website and it allows you to type information and you emphasize that there are health conditions, blood pressure, diabetes, asthma, overweight, whatever, there is a good chance that even though you're below 65, they will give you an appointment. So those are some of the remarks. I really think that we should save rest of the time for some questions. Dr. Shahnawaz, do you have the list of questions or not?
Yeah, I do. So do you want to take the first question or you want me to take the first question?
Okay, let's see. The first, I will take it and then you can expand on that.
That's fine. That's fine. So
Let's see.
everybody, me and Dr. Saleem Khan is going to try to answer all the community's questions as the best knowledge we have. And please bear with us. So we both will try to give you the best answer possible.
Sure. So the first one is, what is the long-term side effect of the vaccine? As you repeatedly heard from Dr. Shahnawaz Khan, there are many things which officially, scientifically have not been studied because of the time limits. So there is no prediction or projection right now for anything serious to happen. You want to add to that, Dr. Shahnawaz?
Yeah, so the thing is that it is a very broad question, and usually the long-term side effects, actually it is hard to answer because the vaccine hasn't been out for a very long time. They've been rolled out at the end of last year, and we're still in the process of trying to immunize everybody. So it hasn't been like evaluated for long-term side effects. However, like any medicine, there's always side effects, which I went over in the presentation, but also at the same time, I'm going to say that it also depends on your age, your sex, whether you're man or woman, also your comorbidities, like you have any high blood pressure, diabetes, heart patient. If you're a cancer patient, you're receiving chemotherapy, or if you have HIV or any other immunocompromised state. So each one person's body response is going to be different. And same thing as how they're going to be side effects is going to profile is going to be also different from that too. So the thing that, but it should not discourage us from not getting the vaccine. So I still urge you to get the vaccine so that you can at least have some sort of immunity rather than none. And the thing is that if you are one of those special groups that I mentioned earlier, or even if you're a healthy person, Corona sees no age, sex, race, or religion. It will kind of affect you. And once it affects you, the symptoms can vary from, mild flu-like symptoms to a death. And we don't want our loved ones or anybody we know that we care about, or just know somebody, want them to be passing away or being suffering, because as a good human being, we all want everybody to be healthy so that we can all enjoy this life together.
All right, Dr. Shahnawaz, I'm going to read the second question, which is, what are some remedies to do home if having mild symptoms? I was reading this article, actually, it is here with me. Mm-hmm. According to that, till recently, the advice was just stay home, like, the cold symptoms and tough it out. Till recently, the FDA approved man-made antibodies, the big name Bamlanivimab.
Well, there's also Covigen injection too, that is serum antibodies against this. Right. But go ahead, sorry.
No, so I was going to say, but when I read further, it says it is one shot and given in IV. So I
Right.
can't imagine people getting IV while they have symptoms at home. So you deal with those patients all the time. What's your
Right.
advice for those?
So the thing is that serum antibodies, like I said, in my earlier slides, creating active versus passive immunity. So they're used to decrease the intensity of the infection if you do get symptomatic or has infections. So it kind of works in a pinch to get you by. However, they don't create long-term immunity like vaccination. So still, I would urge to get vaccination at the earliest as possible because you want to get active immunity possible. These antibodies will protect you within 90 days. So you are a little bit, safe to say that they would keep you safe. But the thing that these safety net is very short-lived. And once those antibodies starts to die off, like any body cells in the body, then you'll be back to open for infection. So do get vaccinated. However, the vaccination and antibodies do have a deal that if you do get it, I would wait until your 90 days is over to get your vaccination done. Or if you don't get antibodies if you already got the vaccination in the pinch. Because if you do have symptoms after the first vaccination or second vaccination and you still haven't developed any antibodies, my thing would be go to the hospital and get yourself treated. If the doctor or healthcare worker or provider feels that you do need that, they will give it to you. Otherwise, don't ask for it because like any other antibodies also have side effects too.
Okay, so again, the question was about the mild symptoms at home.
Right, so mild symptoms, yeah, go ahead. If you want to take that or you want me to take that?
No, I mean, we are still talking about the same.
Right.
What are you advice you are giving it to or prescribing?
So it is a virus, like a flu virus. Most of the symptoms also kind of interchange with the flu virus. My thing would be hydration and Tylenol are your best friends because Tylenol, like I mentioned also, if you're pregnant and you can't take much medication, you can still take that safely. However, the safety of these medications have been proven, and if you do that, that can help you kind of get what you need to do. Rest is also important because it does drain you from your energy source. So a lot of people rest, hydrate, and also take Tylenol for the time frame they do go through this mild symptoms. Most symptoms are over within a week to 10 days. So that's why the current CDC recommendation is to stay home from your job and everybody else quarantine for 10 days right now.
Okay, so if I could add to that if someone is really positive, they have been tested and the symptoms may not be severe and they're staying home because more and more trend is developing that people stay home,
right.
Then you have to worry about your family members. And I'm hearing here and there from friends and family that in those cases, they are really going to separate rooms, trying to avoid giving the infection to the others. Also, if I may add about the home thing, if you already, it is established you have a positive corona, then the next thing that I'm going to tell you, actually developing or your immune system, increasing it, you should not do that. It can harm. But if you are healthy, you're okay, and you want your immune system to be healthier and develop it better, the recommendations are, besides having healthy lifestyle, meaning rest, exercise, good nutrition, and you can have some supplements, which is vitamin A, vitamin D, vitamin D, vitamin C, zinc, and copper. Those are the four things most commonly recommended.
Right. I want to add one thing to the Dr. Saleem's deal. A lot of people have been using that, and but there is no clinical data that they do what they're supposed to do. However, it does boost their immune system. So the theory is you increase your immune system's effect or make your immune system more healthy so it can fight off the infection. But there's still a lot of the data needs to be looked at it into these, that how effective these things are. But it at least will give you a chance against the virus, because at this time, because of the limited amount of resources we have, we're doing everything we can to combat this virus when you're sick.
Okay, so moving along, is should a person who was infected already take the vaccine? I think we already talked about that after 3 months, you can.
Yes.
So I think rather than spending more time, it has been nicely addressed. And then next one is that does the human body of the infected person develop a plasma which is better than the vaccine? I don't
So
think
this goes back
it
to
is.
the antibodies. Plasma
Yeah.
is in the antibodies are in that plasma, and that I think I addressed it earlier too. That for the person who developed it, it is long term for him. But if you're taking that out and giving it to somebody else, antibodies, then those are short lived. So you shouldn't be completely hanging your hat on that, and but still urging for those people to go get their vaccination rather than these other sources, which are useful in a pinch, but not for long term.
Right. So the next question is, does the effect of the vaccine differ from adults and children? Again, in some ways it has been addressed that
Yeah,
under age 16 for Pfizer and under 18 for Moderna, it has not been studied yet.
right. So children's are not even considered for the vaccine anyway. So it's
Right.
usually for adults. So it's same, but it also, like I said, the effects of the vaccine differs based on your age, sex, race, and also what kind of medical conditions do you have. So based on that, all these things happen. And if you have any prior allergies or allergic reactions to the prior other vaccines like flu vaccine and other things.
Right. So the next one is, does the vaccine has any dangerous side effects for patients with heart disease? I think it has been addressed.
Right.
That the one I mean the answer, one word answer is no, there isn't any increased risk, but
Right.
actually, if anything, they should be getting it.
Exactly, because they're more likely to have more severity along with the other medical problems to deal with it. And if they get the vaccine, at least they're safe from one side of the infection. They can just focus on their own current medical conditions and deal with that. However, dealing with two sometimes maybe too much for somebody who's been very ill or have been very frail. So I recommend that mostly people in that situation who are very frail, unless there's a contraindication to the vaccine, they should go ahead and get it at the first place.
Okay, Dr. Shahnawaz, we are doing very well with time. We have 3 minutes and 2 questions. Did COVID have new strains which are not treated by the existing vaccine? Again, it was addressed nicely by Dr. Shahnawaz. Obviously all these companies which are already have developed the vaccine, and those which are developing, they will be mindful of it and they will be tweaking their vaccines to address that.
Exactly. But it shouldn't,
Okay, so,
again, it shouldn't keep you from getting the vaccine. So do get your vaccine.
right. Right. So the last question is, can a person get infected after getting the first dose of the vaccine? The answer again is yes, they can.
Yes.
Because it does not give you immunity 100%.
Right off the
Actually,
bat.
more, right. It is saying that 60 to 80% are in these two vaccines that we have around, and 95 to 95% after the second dosage. I should also add that the effect of even the first dosage does not start working fully after almost a month. And then the second one needs another month. So you should feel more comfortable after a month of the second dose, which is from area to area, including our area, it has become a challenge where to get it.
Right. My thing would be, go ahead, sorry.
No, I was going to add that I am already somewhat working with the management at ISD, but I will be working more, and as needed will consult Dr. Shahnawaz Khan to develop a group of volunteers, because there are some who are very ready, who will be only as far away as a telephone call to ISD, and then they will be filling out the forms so people can get scheduled easily. Those who are tech phobic or cannot deal with all this scheduling thing.
So my thing would be, between the two vaccines, you still have a chance to get infected because the immunity takes time to develop. So during that time, being less vigilant about the infection by not sanitizing, wearing masks, and avoiding places and hand washing. If you don't do that, you still can get infected. And if you do get infected, you have to wait longer to get your second shot because they won't let you have the shot if you're symptomatic. So my thing would be to stay vigilant. That's the only way we can stay safe, get your vaccine in time and get the right type of vaccine and with the right dosage. Again, I'm gonna say the cards that are given after the first vaccine, please, those are very important. Don't think it's just a piece of paper because when you go for a second vaccine, they would require you to present those cards with your name and the type of vaccine that you received, because they're immunizing hundreds of people. They're not going to remember what you got when you got it. They're simply giving vaccines because you showed up that day, and then that's the only piece of record that the state is keeping, and it's your responsibility. So don't lose that card, and do get vaccinated, and do keep yourself vigilant about the infection.
About the card, if I could add, people are excited. Many of them are putting the copy of their card on the Facebook or other social media. Do not do that. It compromises your safety.
Exactly.
So thank you very much for everyone who attended. Hopefully it has been helpful. You can still send questions, and through the administration, we will try to reach out to you.
One last thing I just wanted to add, me and Dr. Saleem Khan were thinking that we'll be talking with the ISD Board of Executive Committee to have this presentation on the website, so more people who weren't able to join in would be able to later on watch it and learn something from it. And also trying to provide a link to register for vaccination for the Delaware.gov, so that people who are not able to get into or don't know how to navigate the website of the Delaware, they would have a good link through ISD to get registered and get immunized in time.
Yes.
So I would leave that, and I hope this presentation, which I worked tirelessly since I found out ISD was wanting to do that, was helpful and informing people. It was completely different from the last one where we were trying to figure out what this virus was. This was how we tackle this virus, and as a community keep everybody safe and healthy. And hopefully next time if we do this kind of talk, we'll say we've done it and we conquered it, and we'll have back to our normal life.